This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And in Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
our topic today is on bariatric surgery.
You have to look for your forward.
So tell us, what is a pre-op diet?
Surgery, it's not just you do the surgery and you just go.
Are you someone who's suffering from obesity or perhaps severe health issues related to the obesity? Have you tried before dieting and exercising but were unsuccessful? I am Dr. Khawla, and in this episode, we will navigate one of the effective tools to losing weight, and that is bariatric surgery. Hello, Dr. Hani, how are you? Thanks for having us today.
You're welcome.
So, Dr. Hani, talk to us about how do we classify obesity and how do we use this classification to decide who's getting bariatric surgery?
Yeah, classification of WHO according to body mass index, which is actually a ratio calculating the weight divided on square or factor to the height. And we get a number. That number, we call it actually body mass index. And according to the number, we can classify the classes of obesity. So talking about 25 to 29.9 is overweight. 30 to 35, it's within it is obesity classes. Class 2, we consider the 30. It's a 40 and above. So these are class 2. 50 is super obese. They are class 3, BMI of more than that. So indication for surgery according to those classes. For instance, BMI 35 with other diseases like hypertension, diabetes, hyperlipidemia, joint problems, disc prolapse, which preclude patient to lose weight.
Yes, and problems because of the obesity.
And the problem actually because of the obesity. So we indicate for them the surgery. However, a patient who has no one of those factors, like BMI of 40 and above, directly we indicate them for surgery.
So what are the steps that you have to take, Dr. Hani, before you send someone and say, you're okay for bariatrics?
Well, selection of the patient for obesity surgery needs a thorough workup. So we have many types of operation we can offer the patient.
Would you be able to show us, Dr. Hani, on a diagram or on a...
Yeah, absolutely. So, okay, this gentleman is my friend, and I need to take out his organs to show you the stomach. The stomach is this part of the body, sits behind or below the diaphragm, below the chest.
Yes.
And this is the shape of the stomach. If we take this line, you see there is a line, I know it's difficult to see. If we draw a line from here to there and take all this part of the stomach out and leave the stomach with a small one, which is about 25 to 30%. And that we call it sleeve gastrectomy. The other procedure, we don't take anything out. We just create a small stomach out the big stomach.
I see.
And we bring it apart and we join it with the small intestine. So it means that we bypass it. We bypass around 150 to 2 meters. We have bypass and we have mini bypass. In our language, we call it single anastomosis bypass. So those operations, they have different indications. First, we consider the patient, is he suitable for obesity surgery or not? to which type of surgery he is suitable for. And for that, we have to conduct a thorough investigation.
Very good. So I heard, Dr. Hani, we have a patient who actually might get surgery tomorrow, depending on some endoscope procedure that we're going to do today. Can you talk to us a little bit about that?
Yeah, endoscopy and some x-rays are part of the workup. So we do ultrasound of the abdomen. We check how big is the liver and is it healthy or not, because as I show you on the mannequin here, the liver falls on the stomach. So we have to make sure those patients, they don't have fatty liver, or help them to take a protocol of diet to shrink them. The most important thing is endoscopy. Imagine we are doing a surgery on the stomach, so we need to assess, is this stomach healthy, suitable to have the surgery or not? We have an ulcer, we have a cancer, we have bugs. We need to know, and we need to have more understanding what's going on with this stomach before going ahead to do surgery. So if we detect anything, we go and treat this in advance.
Very good. So, Dr. Hani, talk to us. Why is it important to do an endoscope before bariatric surgery?
Yeah, so basically, any patient who's going to have a sort of bariatric surgery, regardless it's a sleeve or bypass or mini bypass, we need to do so. Yeah, as you can see, I'm going into the duodenum now.
Okay.
Yeah.
So this is part of the small intestine.
This is part of small intestine, and this is the ampulla. Okay, which is, we call it the second part of the duodenum. We pass the stomach now.
Yes.
And we make sure everything is fine, looks like healthy in this patient.
Okay.
And pulling it out a bit.
So healthy is pink, fresh.
Pink, yes, fresh, no ulceration, no suspicious lesion. All right. And then we're going to check the first part of the duodenum, which is also behind the stomach. And this is the first part of the small intestine. After passing the stomach, this is also looks good, healthy, fresh, no lesions. And then I pull back into the stomach. Okay, this is the stomach, and this is the window between the stomach and the small intestine. We call it the pylorus.
Right. Mm-hmm.
And this is kind of a sphincter. You can see it's moving, and yeah, that's which keeps the food in the stomach for 2 to 3, sometimes 4 hours. Then we're going to check
digested.
Yeah, correct. Mm-hmm. And here we're going to see the stomach lining. Everything looks to me fine. Some nodularity, which is non-specific, for which I'm going to take a biopsy. Maybe sometimes the patient, they have old infection or something, but apparently now I don't see any ulceration or something which contraindicate the procedure. Then I'm going to check this upper part of the stomach. As you can see here, we call it the fundus.
Yes.
Yeah, it looks nice, well distended, healthy. And then I'm going to check the opening or the window between the esophagus and the stomach. You know that up the tube there?
Yes.
So the space between that scope or the camera in the endoscope and the stomach is small, it's tight. So that means we don't have hiatus hernia.
Okay.
As a part of routine procedure, I'm going to take a biopsy, and that biopsy will give us microscopic, which means the lab assessment of the stomach lining. So we'll be more objective other than just on subjective endoscopic pictures.
Right.
So
to make sure everything is...
To make sure everything.
It's fine.
So all that we do to make sure that procedures we are doing it safe.
Yes.
And safety for the patient.
That's right.
So, you know, the safety is our priority to do any surgical intervention.
Yes.
So here they're going to have the biopsy thing. Yeah, here's for tomorrow. And now I'm going back just to take part from the lining. I took a biopsy. Okay. We have a test, we call it claw test, to see if the patient, you can look at here, there, behind you.
Uh-huh.
And that test we put the piecemeal of the lining of the stomach there.
Yes.
So can show us if the patient has the infection or not. So the color can turn to purple, which tells us if we have infection or not. And they are doing it. And we're going to keep it for a few minutes. How long, Aisha, we're going to keep this?
Within 10 minutes, this changed the color. This is rapid test.
Rapid test, which is within 10 minutes.
In 10 minutes, it gives us a result having
infection or not. So if we do have infection, then we're going to treat the patient for 2 weeks for the bugs.
Was there ever a case, Dr. Hani, where you found something on the endoscope that changed the course of surgery?
Yeah, it happened. So once we found an ulceration, so we need to treat the patient for over more than 6 weeks. And afterwards, we recheck again. If everything is fine, then we go back, then we treat the patient for surgery. All right? So here now we're done with the biopsy, and we draw out the scope slowly. As we go, we check the mucosa. As we travel out, now this is the lining between the esophagus.
Yes, you can.
And the stomach's different type of lining, different type of cells. Draw out slowly, just a zip line. Let's see.
Very good. So we're confirmed, I guess, for surgery tomorrow.
Yes. Okay. After seeing the
results of the test.
So here I'll show you this test. So we have actually markers, yeah, and show you when it is positive. It's kind of like a pregnancy testing, but in the different way. It's for the bugs. So if it's turned to purple, that means that it's really positive, which has the bug in it. If it stays yellow, which means that the patient has no bugs, so no need to treat the patient.
Hussein Lutfi. I am 47 years old. I was 122 kgs. I lose more than 47 kgs now. I am very, very, very happy, really. I changed my life. I am in the dream now. When I see my photos, I see before our photo, I don't like. Now I'll be changed. Really, I am happy now. Really. I changed my life. Now I go for retire. Now I'm retirement, but still I'm looking smart. That's why. I will do my best, and always I see my forward. I don't like to see my back because I was poor. Now, always I'm smiling now. Not same before. Before it's always, I don't know where I go. No, I have to change. I want to go outside. No. Because I'm not looking smart. How can I go with my family? How can I go to gathering? How can I go outside? Now, I will be changed, really. Now I'm different Hussein, not before Hussein. New Hussein now. Hi, doctor.
Hi, Hussein. How are you? How are you doing?
All right.
So it has been almost 6 months now after your surgery. Yeah? You're weighing 73 kgs. I just would like to remind you, what was your initial weight when you came to me? It was 124 kilograms. So pretty much you're doing very well. So in terms of your blood pressure, is everything okay?
Yeah.
You taking those pills or not anymore?
No, everything okay. I'm very happy now.
I remember, yes, we can see in our records it was 150/95. And today it's just 130/75.
Very good.
So that's really success.
Hello. Hi, Dr.
Hello,
Hani.
hi.
Hi,
Hi,
Hussein.
how are
Good
you?
to see you.
Good to see you.
It's been a while, Dr. Hani.
Yeah.
Thanks for having us again.
Thank you for coming and joining us.
We're
You
here
remember
to check
Hussein
on
now?
Hussein, yes.
Yeah.
How are you feeling,
Okay,
Hussein?
I'm very good.
Good, good. And you feel good in terms of health-wise, activity?
I will be changed now, different Hussein.
Wow, that's great. So I think I overheard something about blood pressure getting better, right?
Yeah.
And no longer taking any medication.
No, I didn't take any medicine now.
Very
Everything
good.
back to normal. I didn't take any medicine. Our
Excellent.
back pressure is normal now.
So Dr. Hani, the surgery is, we've established, it's not cosmetic, it's metabolic, it treats underlying problems.
Absolutely.
Because I have a lot of people who I see sometimes who say, well, I don't want to risk the surgery or complications of surgery, but they already have really terrible diabetes and blood pressure issues and all of that stuff. And so surgery, in this case, the benefit outweighs any potential small risk that can come with it.
Yes, absolutely, because leaving a patient with obesity is not getting better.
That's
It's getting worse by time. He will have hypertension, and then the diabetes can cause other problems like atherosclerosis, which means that our arteries, they're getting narrowed, and that will affect the heart. They get heart attack, they get a problem with the stroke. So the other problems, the metabolic related problems related to the obesity. So doing it now when he is fit and well, better than doing it later when he has all those problems, the risk will be higher, of course.
So Dr. Hani, a lot of people think surgery is a one-time thing and then you just go home and that's it. Is that the case with bariatric surgery? Or should people follow up and take certain drugs and medications?
Yes. Actually, surgery, it's not just you do the surgery and you just go. Needs really dedicated follow-up, dedicated patients. They need to have continuous follow-up. They need to be on their vitamins or the protein supplements, the whole through. All the surgeries, sleeve gastrectomies, bypasses, mini bypasses, and all sort of the obesity surgery, they need to have a regular follow-up and they need to take their pills and regularly.
Thank you, Dr. Hani. That was very informative.
You're welcome.
And thank you, Hussein, for having us today. We
Thanks,
appreciate
Dr.
it. Did you know that losing a significant amount of weight via diet and exercise can sometimes be very hard? What is even harder is trying to keep that weight off. Now, ever wonder why that is? One of the reasons is that our brain controls our body weight at a particular set point. Any attempt to deviate from that set point, whether it's up or down, will be met initially by resistance. Resistance comes in the forms of decrease in satiety hormones, increase in hunger hormones, and a decrease in the metabolic rate. Now, interestingly, bariatric surgery is one of the only tools that have been shown to actually alter that set point down to a lower one. Bariatric surgery is not just a restrictive procedure, rather it's a procedure that changes our gut hormones by increasing our satiety hormones and decreasing our hunger hormones to make us feel comfortable with the new weight that we've reached. Now, patients have to follow a very specific diet both before and after bariatric surgery. In order to find out more, I'm going to meet now with dietitian Maysa. How are you, Maysa?
Good morning, Dr. Khawla. How are you?
Good morning. Good, good. So tell us, Maysa, why is it important for patients to follow a pre-op or before surgery diet?
Actually, the thinner the patient is at the time of the surgery, the easier it will be and the less the complications are. So even the size of their liver will shrink due to weight loss, and this will help a lot the surgeon to perform in a better way. That's why I always advise my patients to go for a pre-op diet 2 to 3 weeks before their surgery.
Very good. So tell us, what is a pre-op diet?
Actually, pre-op diet, it's a very low-calorie diet, high in proteins. So patients can have protein shakes throughout the day, 3 shakes in a day, 1 for breakfast, 1 for lunch, and 1 for dinner. And in between, they can have calorie-free liquids like water, unsweetened juices, sugar-free jelly. What else? They can have as well decaffeinated coffee or tea. And here we have an example of a good protein shake. So this is the whey protein that provides per serving. Yeah, this one, and as we can see in the picture. So it serves per scoop 25 grams of protein, 3 grams of carbs, and 2 grams of fats, and 130 calories. And if they want to have just another protein, they can go for the protein isolate.
Very good, very good. Now let's move on to the post-op or after surgery diet. So why do patients need to follow a diet after surgery?
Actually, straight after surgery, patients have to be MPO. It means they should not be eating or even drinking anything, not even water. And once the results are ready and everything is fine, we can start with sips of water gradually. And once water is tolerated, we move to phase 1 diet. This diet, the phase 1 diet, actually will be for 2 to 3 days. And it may begin first day post-op or the second day. Once water is tolerated, we just start with the phase 1 diet. As we can see on the tray, we usually give our patients within the hospital stay before getting discharged diluted juices, unsweetened of course. So as we can see on the tray, we have unsweetened cranberry juice, unsweetened apple juice, as well as rose water. And only third the cup is the juices, and the rest is diluted with water. We give them as well sugar-free jelly. We give them room temperature clear chicken or vegetable broths, in addition to anise or chamomile with a splenda of stevia, of course not sugar. And with regards to the jelly, it has to be green in color, just to know if any bleeding happened after the surgery, just to verify the issue.
Very interesting.
So we'll not be confused if this is from the jelly or from the bleeding.
That's right, because most jellies are red.
Exactly, that's why. And this one is sugar-free as well.
Okay.
So when they go home, they have to follow the phase 2 diet, which will be for 2 weeks. It's actually a high-protein diet, very low in fats and sugars as well. We usually give the patients, or patients can have, milkshakes prepared with skimmed or low-fat milk. They can have homemade strained soups with added milk for additional proteins. Even for the cup of milk, we can add 2 or 3 tablespoons of milk powder to add more proteins. Because in this stage, our goal is to reach 60 to 80 grams in a day. As well as we give them mahalabiya and custard made with Splenda or stevia, and all low fat of course, and low fat or skimmed yogurt. Once phase 2 is well tolerated, patients can move to phase 3 diet, which we can introduce in this phase mashed or pureed foods like low fat spreadable cheeses, low fat labna, scrambled eggs made of course with no oil, blended vegetables. In addition to, we can add even to the blended vegetables or soups minced meat, low fat minced meat, minced chicken, as well as fruits like ripe bananas, apricots or plums. But with regards to the fruits and vegetables, patients should not be having them unless they well tolerate at least 3 meals containing chicken, minced chicken, fish or meat. So actually patients, when they well tolerate the stage 3, which is mainly will be followed for 2 weeks or more, they can start with the soft diet, which is the phase 4. And that one will be followed for 3 weeks or more. So which we can introduce in this stage. Patients might not tolerate eating red meat, raw fruits or vegetables, and even the bread if it is not toasted. So we tell them not to worry about these, just they can have them 2 weeks from starting this stage, so their tolerance level might be a bit better. And in the whole day, they can have up to 4 to 5 meals containing like 60 grams of chicken, fish, or meat, in addition to 2 tablespoons of vegetables, blended vegetables or very soft vegetables with carbohydrates. Actually, in this stage, we start introducing a little bit of carbs, but not more than 2 tablespoons in a day, like 2 tablespoons of rice, pasta, or even mashed potatoes. And finally comes the last stage, which is the 5th stage, when we usually can give the patient, we tell them to eat anything they want, normal foods, but it has to be low in carbs and low in fats, just to keep off the weight.
Very good. So is bariatric surgery, Maysa, just for weight loss, or are there additional benefits to it as well?
Actually, weight loss is one of the biggest goals that will be achieved straight after the bariatric surgery. But definitely there are a lot more of goals that can be achieved, and can be as well improving the quality of life of the patient as well as his overall health, such as controlling his diabetes, hypertension, and really a lot more of obesity-related problems.
Very good, very good.
Thanks.
Thank you. Thanks a lot.
I will ask my people really try to avoid having the surgery done if it's possible, if it's not too late. So by taking consideration the sport, diet, and changing lifestyle. However, if it's, we say, late and you are already in the obesity, try to manage this with the dietitian, with obesity medicine, other way of losing weight. Okay, this is one thing. If you fail to do that, then please come to me to help you, to put you back on your track, on the right track.
Dr. Hania Saati, really he changed my life, really. Always he's follow-up. I have a follow-up with doctor. Always he call me, what about you? How many you reduce now? I said 3 kgs. Oh, really, you do something. What about your plan? Where you go? Okay, I go for riding, I go for horsing, I go for exercise. I sit with my family now, I am different. I feel very nice. I changed my life also. Really, I am happy. Thanks, doctor.
Every week at Health Hub, we bring you the latest and most relevant information to your health. I'm Dr. Khabla, and I'll see you next week. Stay safe.